Many people use the term heart attack and heart failure as if they are the same thing. Are they really the same thing? Stick around to find out, because in today's video I'll be explaining the key difference between heart attack and heart failure. These are completely two different conditions. Understanding their key difference can literally help save your life. So let's dive in. Hello my beautiful audience. Now, if you're new to this channel, you are welcome. Do well to subscribe so that you'll be notified anytime I post a new video. So what exactly is a heart attack? How do you classify heart attack? A heart attack happens when there is a blockage in the arteries that supplies blood to your heart muscles. Now, this blockage can either be caused by blood clots in the blood vessels, cholesterol buildup, or narrowing of the blood vessels. Sometimes sudden stress or exertion can trigger it, and when this happens, the heart stops receiving oxygen. The affected muscles begins to die off within minutes. I'm going to be mentioning some symptoms of heart attack you should watch out for. Heart attack is something that comes suddenly and gets worse. So when you see these signs, when you see some of these symptoms, you should rush immediately to see your doctor. And number one sign is intense chest pain or tightness. You feel a heavy pressure in your chest as if something is sitting on your chest. And next is sudden shortness of breath. In fact, this is one of the most common signs of heart attack. If you notice shortness of breath, sudden shortness of breath, and chest tightness, you might want to rush to the hospital immediately. Now let's move on to the next one, which is cardiac failure. Now, cardiac failure does not mean that the heart has stopped working. It simply means that the heart has become weak, stiff, or tired, and it cannot pump blood effectively like before. Cardiac failure is not something that happens suddenly like heart attack. Now, it takes slowly, it can take months, it can take years. One of the major causes of cardiac failure is uncontrolled hypertension, a previous heart attack that scars the heart muscles, heart valve problems, long-term use of alcohol. Alcohol can actually damage your heart infection. All this can contribute to cardiac failure. Symptoms of heart failure are quite different because they happen slowly and are related to the heart being too weak to pump blood. Now, symptoms include shortness of breath, especially when lying down, feeling always tired and weak all the time, swollen feet, ankles or leg. You maybe notice that your feet is swollen, your ankles, persistent cough, especially at night. All this could suggest cardiac failure. All these symptoms usually comes gradually and might get worse over the years. Now, cardiac failure is a slow poison. It's something that happens slowly. It can take months, it can take years. A quick recap: heart attack happens when there is a sudden blockage in the artery that supplies blood to the heart muscles. Now, when this happens, the heart does not get enough oxygen, or maybe does not get oxygen at all. For cardiac failure is a weak heart, a heart that cannot pump blood effectively. Heart attack is an event, while heart failure is a condition. And one more thing, heart attack can actually lead to heart failure if it damages the heart muscles. Key difference between heart attack and cardiac failure: one is sudden, while the other happens gradually. Understanding both helps you to recognize symptoms early and protect your health. Now, if you find this video helpful, give a thumbs up. Don't forget to like and subscribe.